We're back with another episode of a conversation about COVID with our panel, YPG Commander Colonel Patrick McFall, Technical Director Larry Bracamonte, Health Clinic OIC Major Jennifer Fiandt, and Acting Deputy Garrison Manager Ron Rodriguez. Colonel McFall, do you have any opening remarks, sir?
I want to thank everybody for tuning in and listening to this broadcast, because this is very important information that we're trying to project positive behaviors and hopefully get control of what's going on in COVID, but also to answer the questions which you have asked. Mark?
Colonel McFall, with COVID numbers rising in the Yuma area, have we seen an increase of cases here on YPG? And do you expect we're going to go back to HPCon Charlie at some point?
Mark, we are seeing an increase in cases. Those cases are coming from off-posts. I believe the experts and the data have saying that most of the stuff is from people who are either in gatherings or friends or however who may not be wearing masks. CDC recommends wearing masks. I keep pushing and stay vigilant on that message. We must wear a mask. We have proven if we wear a mask, it has been a protector for all of us. And we proved that there in Project Convergence 20. As far as do I see us going to HPCon Charlie, I am doing everything in my power to prevent that. We may see some change in procedures and guidance out there, but I find it very important that we protect the amenities for our YPG families, specifically those who live on YPG, since we are very remote. I understand the importance of those benefits to our family, and we're looking to keep it protected, but I'm asking for your help.
Mr. Bracamonte, if someone in the workforce tests positive for COVID, what are the procedures for notifying their workmates? And does that person have to have a negative test before they come back to work?
So first of all, Mark, there's going to be a mission trace team that's going to look into the matter. They're going to interview the positive or the symptomatic individual and determine a couple of things. One, was the individual wearing a mask? Was the individual at least 6 feet apart from the other worker? And was the contact for 15 minutes or less during the entire day? If that's the case, then no workforce notifications are necessary. However, if the positive or symptomatic individual or close contact individual did not follow the guidelines, then the workers who came into contact with him or her will observe a 14-day quarantine period. Now, the point here is that the exposure individual may test out of the 14-day quarantine period no sooner than 5 days from the most recent exposure, which would be day 6, providing that the individual has a negative COVID-19 test. Now, the positive or the symptomatic individual must complete a minimum 10-day recovery period, with the final day being fever-free and a reduction in overall symptoms. Once an individual tests positive, they cannot test out of the 10-day recovery period. So if the initial test by a symptomatic individual returns a negative result, then the individual is then simply placed on sick leave.
I'd just like to add on to that the mission trace team is in contact with those of us here at the clinic on a daily basis. If they have any question about what kind of determination they should make regarding a contact trace, then they give us a call and we kind of help guide them through that. We've had a great working relationship with them so far, and we look forward to that continuing in the future. But the other reason that people don't need a negative test result after they have had a confirmed case of the coronavirus is that the test is far more likely to have a false positive than a false negative. That means is that after your body has fought off the virus, there's bits of that little bit of killed virus can persist in your body, and the test will react to that as a positive even though you're no longer positive. As a result, the CDC does not currently recommend retesting anyone who's had a confirmed case of the coronavirus for at least 3 months. The thinking is that your protective antibodies will last at least 3 months, but after that it is much more unknown.
Major Fiandt, can you walk us through what it might look like once a COVID vaccine becomes available?
Yeah, sure. So there are, first of all, a lot more unknowns than knowns at this point, but a couple of things that we do know. First of all, there are 3 vaccines that are likely to be available soon: the Pfizer vaccine, the Moderna vaccine, and the AstraZeneca vaccine. The first 2 have already applied for authorization from the FDA, and the third one is expected to apply soon. All of those vaccines have performed well in large-scale tests, both in terms of their safety and in their ability to prevent COVID. We don't know for sure which vaccine we will get, although it seems likely that we may get the Moderna vaccine. The U.S. government has already purchased 100 million doses of this vaccine, and our clinic can safely store that vaccine. When we do get it, that first allotment that we get is probably going to be very small, and it's going to be for healthcare workers and first responders only. As we continue to get in supplies of the vaccine after that, then it'll be basically priority, active duty, high-risk patients, dependents, et cetera. It's all going to depend on how much we get and how we're given that vaccine. What we do also know is that all of the vaccines that are likely going to become available soon are 2-dose series. So you're going to get to need 2 shots, basically 3 to 4 weeks apart, depending on which vaccine it is. The reported side effects are pretty comparable to the flu shot. Some folks will feel crummy for a day or so. You're probably going to have a kind of a sore arm, but that's really it. There's no risk of infection because you're not getting dosed with anything that's can cause an infection, and so therefore there's no need to quarantine.
Do you expect you'll provide it to civilian workers here, or just active duty and your regular patients?
I'm sure we will eventually. It's just a matter of how much vaccine and how much we get it and when. But I predict that we're going to get an amount for all of our workforce eventually. Just not sure when and how that's going to come in, because obviously vaccines have been a tough issue this year.
We said healthcare workers and first responders. When we say healthcare workers, we're talking about the military healthcare workers?
Yes, sir, as well as all the civilians in the clinic too. Anybody who touches a patient.
Inside of the YPG clinic, correct?
Yes, sir. I'm getting clarification on the free fall folks right now.
Okay, thank you. And that does not and then the first responders is, of course, the fire department, police force, those type people.
Yes, sir.
But it does not include is if you're a healthcare provider working in town, it does not count for them.
Right. They should be able to get it through their own links because obviously YRMC is going to get dumps of vaccine. The county health department is going to get allotments of vaccine as well. So there should be other sources for those folks. And again, it'll just kind of have to be on a as supplies come in basis because, yes.
No, that's fair. I appreciate you clarifying that. And it sounds like a pretty reasonable response. So thank you so much.
Mr. Rodriguez, what is post-life going to look like in December? Do you expect there'll still be a tree lighting ceremony and things like that?
So our intent at this point is to do all the things that we normally do this time of year. The tree lighting, the Santa Claus visit on Christmas Eve, the angel tree. But we're going to try to do that in a manner which incorporates CDC guidelines in a safe manner and potentially subject to change, but that won't be done in a vacuum. That'll be done in conjunction with the senior commander.
We are not at the peak. All the experts say we're not at the peak, and the data, if you correlate back to the summer when Arizona was in the news, is not at the peak. I think the projection for the peak, and correct if I'm wrong please, is around December 25th, the holiday seasons. What that looks like, will it go higher? I do not know. But it boils down to behaviors. We have to manage our behaviors in accordance with the CDC guidelines. Mass fatigue is a real thing. Mental fatigue, I believe, is a real thing. And I think people are tired. But I'm asking everybody to keep going. It's not only to protect you, but protect the post, protect the mission, and just keep us safe.
It comes down to behaviors. So watching that graph in terms of how it tracks up, and then when we plateau in terms of COVID cases, and then things get better, that plateau, those peaks, they're not inevitable, both in terms of the severity, in terms of how bad it can get, or how quickly we can improve. We can flatten that curve. We can keep this from getting worse if we start embracing those behaviors again and avoiding those high-risk activities that, everyone wants to get together and have a holiday season like we normally would, but it's not safe to do so this year. And I think it's especially important that when we think about that in terms of considering that risk, that there is imminent hope on the horizon. We're going to get our first shipment of vaccine soon. I don't know if it's going to be December soon or if it's going to be January soon, but it's going to be here soon and we're going to start those efforts. So there is a hope of a return to normal soon. So taking those risks when we're so close to the finish line just does not feel in any way, shape, or form like a good choice.
Is there a difference in masks that the CDC is saying?
Generally, masks are on a range of effectiveness, right? So kind of the best you've got are those medical grade N95 masks, the ones that don't have painter's valves on them. And then you've got sort of, well-made cloth masks, preferably with a filter or at least a couple of different layers of fabric. And then sort of simple one-layer cloth masks. And then now we're at like balaclavas or handkerchiefs or those sorts of things, where that tends to be a less effective barrier, and you kind of get more pass-through. Obviously, that's just kind of on a scale of effectiveness, right? So that balaclava, it's not that it's not protecting you at all, but it's not protecting you very well. And most importantly, it's also not protecting anybody else very well. Because there is still breath that passes through that. So when we look at what we can do to try to embrace those kind of best practices and get ourselves through this the last push for coronavirus, trying to wear more effective masks that have good layers and multiple filters, et cetera, rather than just kind of going with the easy solution, making sure you maintain that mask. So if it's a cloth mask, it needs to be replaced every day and needs to be washed and appropriately. It shouldn't be the mask that hangs off the gear stick in your car for the next month. So just those sorts of things. And if it's a disposable mask, please treat it as a disposable mask and throw it away. If you've been touching the outside, it's done.
I hear a lot, everybody's tired of the virus, everybody's tired of wearing masks, but again, we are close to the finish line, and obviously if we don't practice safe behaviors, our numbers are going to go up. More people are going to get infected, and unfortunately, possibly more of your high-risk folks, to include the elderly, are going to die as a result of COVID-19. So we want to do everything that we can to prevent this virus from spreading. The one thing I will say is that when you guys come to work, I believe that everybody does a fairly good job of making sure that they're practicing safe procedures. But when you go home tonight, also talk with your families, because they're part of this as well. Talk to your kids, talk to your wife, make sure that they're also practicing safe procedures, because again, if they get you infected, then obviously you can infect your coworkers out here. And that's something that we're also trying to prevent. So like Major Fiandt said, behaviors are important. Make sure you're practicing safe behaviors when you're out there and you're out and about, not only at work, but also off work.
So pretty much since the beginning of COVID, we've been telling people you need to wear masks in different facilities, MWR facilities, AFES, DECA, and we've had some complaints recently, and as have been reflected a couple of times, people are getting tired, and people are getting tired of wearing masks, of people going into some of the food establishments without masks. Now's the time. I mean, it's been pointed out, the masks have worked for us. We have not had any documented cases of people getting COVID in one of our facilities on the installation. Now is not the time to back off from the safety precautions. We are actually going to step back and go to takeout in a couple of our facilities, and then continue dining in a couple others. But if people do not police themselves and wear masks, at some point we'll be forced to look at potentially closing facilities if the rules aren't followed. So we need everybody to just kind of buckle down and make it to the finish line.
I hope this was beneficial, give a little more insight, but more importantly, continue to stress the importance of following the CDC guidelines and those safe behaviors that we all talk about. I want to thank y'all again for everything you're doing. You're all awesome, and I appreciate you. Truth in Testing.